Dr. Harris, 5 trucks, does this even touch the surface when the UN says 500 trucks a day is what's actually needed to address staggering food shortages?
Good evening, Asieh. No, you're right, and I would exactly reflect what Tom Fletcher, the relief chief, said. Indeed, it's minimal. It's just a drop in the ocean of what's urgently needed, and significantly, much more aid must be allowed into Gaza, starting right away. Okay, right away is tomorrow morning, but as soon as possible.
Israel says it finally decided to allow this aid in to ensure no starvation crisis develops. Dr. Harris, is this too little, too late? We're already in a starvation crisis, aren't we?
That's correct. We're seeing hundreds of thousands of people who are starving and who are being starved. And they're being starved of more than just food. They're being starved of medical care. They're being starved of clean water. They're being starved of safety. They're being starved of mental health, of reassurance. You know, every night they are terrified. And the human mind is not geared to being in a constant state of terror.
Dr. Harris, getting in aid, of course, is tremendous. 5 trucks, hopefully it'll be more in the coming days. But how difficult is the distribution? How challenging is to get this aid to the people who need it most when Israel continues its attacks from the air and on the ground?
Indeed. Again, what we need to be able to distribute aid effectively everywhere to everyone who needs it is safety and security. So it's not simply a matter of bringing trucks in, just as you quite rightly say, but to be able to bring them everywhere and to know that the people bringing them in are safe, that they're not going to be bombed or shot. And that also, remember, you've got a population who are desperate. So we need to be able to do it safely and to ensure that the aid reaches the people who need it most urgently.
Well, you also talked about the healthcare system, which is in dire condition from Israel's earlier bombing campaign. Can you give us a sense of how these hospitals, the ones that are still functioning, how are they doing it with so limited life-saving resources and supplies?
It's quite extraordinary, and it really is down to the commitment of the healthcare workers who, honestly, as a healthcare worker myself, as a doctor, I cannot believe that they keep going. And I was going to say that they get up every day and do this, but actually half the time they don't even get sleep. Half the time they're working 24/7. And indeed, one of the biggest struggles and what they say to us all the time is they could do so much more, but they often don't even have the means to keep the floor clean, because they don't currently even have antiseptics or cleaning materials. They don't have swabs. They don't have Band-Aids. You know, all the basic things that you will use to repair somebody's broken body or their illness is simply not there. So no matter how much expertise you have, even if you have a functioning hospital, and you're quite right, most of the hospitals are just shells of what they were before. Even if you had that, if you lack the equipment, you know what to do, but you can't do it.
Well, you know, from day one of this offensive, Israel has insisted that Hamas is using these healthcare facilities and these hospitals as control and command centers. It's sheltering Hamas fighters. Are you hearing anything about this, about these allegations from any of your team members or any of your contacts or healthcare workers who are day in and day out trying to do their jobs in these shattered facilities?
So, Asieh, this is one of the things that I find fascinating. I have never even heard a whisper. Now, we go there to look at healthcare. Let's be fair. We don't go to investigate whether or not there are other things going on, but we don't see anything. And I would expect after 2 years that I would at least hear casual conversations about, oh, we're worried about this or that. We don't hear that. What we see going on is a desperate effort to repair the broken bodies, to heal the children who are either suffering from infectious diseases or starvation. We are not seeing anything else. And really, we just don't understand. It's very clear in international humanitarian law that hospitals are not a target. They're protected, they're sacrosanct. And yet, every day, we are seeing attacks on healthcare.
Yeah, all right, we'll leave it there. Dr. Margaret Harris joining us from Geneva. Really appreciate you coming on. Thank you.